It's important we have no abortion laws because the regular laws that cover medical practice are quite adequate to cover abortion. And obviously, if it's safe for her, every woman should make her own decision about whether or not she's going to have an abortion. I certainly hope that Texas will follow the more advanced states in the union in getting rid of its antique abortion laws. I think that's very important. I think it's very important that the women's liberation movement, short of some of its more extreme advocates, be given a lot of impetus, because I think one of the major factors in the United States and around the world in curbing population growth is changing the attitudes of people towards the number of children they want. And this very much means, of course, changing the attitudes of women towards the number of children they want. And these attitudes seem to be in no small part controlled by what other opportunities are open to women. For instance, in this country, we have a very inadequate medical care for the people in general. As you probably know, we're about 20th in the world in infant mortality. What would be an excellent way to get more doctors in this country? It's to open up the medical profession to women. Right now, they're very heavily discriminated against. Women have to be given the same opportunities as men. That in itself will be a big boost towards solving the problem.
Well, what about the pill, for example? It has a bad reputation now.
Well, the pill problem can be partly solved by getting decent abortion laws or getting abortion laws removed, because it's necessary to have a pill at the moment which is absolutely fail-safe. If you stay on the pill now, the chances of getting pregnant are essentially zero. This means that the pill has to be an extremely heavy dose of hormone, because there's a great deal of variation from woman to woman about how much hormone she needs. And so you have to take the requirements of the woman who needs the most hormone and give her a big extra dose just to be absolutely certain. Now, I think if abortion was freely available to all women, subsidized for those who couldn't afford it, I think most women would be willing to take, say, a 1 in 2 chance of having one unwanted pregnancy during their reproductive lives if they knew that a couple of hours in a doctor's office in a perfectly safe procedure would terminate it if they wanted to terminate it. So if you had decent abortion laws, then you would be able to have a pill that was a much lower dose of hormone and therefore much safer for women. So one of the things that the old men who are blocking abortion law reform are doing is keeping young women on pills that are relatively dangerous, and it's a disgusting